Good afternoon, everyone, and welcome to the Marion Minor Cook Athenaeum. My name is Zachary Corser. I'm the Research Director for the Dryer Roundtable and also a Professor of Government. And today I'm very pleased to introduce a new partner for CMC, Katherine Hayes from the Bipartisan Policy Center. She's our partner for our inaugural year of Policy Lab, which, if you haven't heard of it yet, is a fairly innovative, I'd like to think, new project whereby myself and my co-instructor, Professor Eric Helland, who will be here shortly, he's just finishing up his Econ 50 class, are teaching public policy analysis, but in a very CMC way. The CMC way is that we want to include as much as possible real-world DC experience and teach the skills and give students the tools for working in DC in doing real professional public policy analysis. And we have our inaugural crew here that are scattered throughout of our Policy Lab people who'll be working on a project together with Katherine and her team at the Bipartisan Policy Center related to healthcare funding. So this, in a way, this luncheon is a inaugural moment for our Policy Lab class. Katherine will be meeting with our students this evening, and we'll be scouting out our work plan for this semester and for next semester because it'll be a year-long project. And at the end of this project, we're going to be presenting a report together with BPC based on the research that our students have done. So we're very excited about this new program. We're very excited also to have Katherine because she has a very interesting and varied career in public service and in healthcare policy. Prior to her work at the Bipartisan Policy Center, she was an associate research professor in the Department of Health Policy at the George Washington University School of Public Health and Health Services. She also served as a vice president for health policy at Jennings Policy Strategies, and she's also had a career on the Hill, working for the U.S. Congress. She worked for former Senator Evan Bayh of Indiana, and she also worked for Senator John Chafee from Rhode Island. She's also worked in the states as well. She was a program consultant for the state of Missouri in their Medicaid agency. And she also worked as a health and education policy advisor for the state of Texas, their Office of State-Federal Relations. So she's got experience at the state level, the federal level. She has a law degree. She's taught public policy. I don't know if we could ask for much more in terms of a varied public policy career. And we're very happy to have her here today to talk about a very pressing question that may not get answered, sadly. As we followed this election, we know that we barely know which end is up, whether you're a Republican or you're a Democrat, in terms of who to vote for right now. But there's still work that needs to be done. And one of the most needful policy areas is healthcare. And there's a lot of must-pass legislation that's before the Congress now and will be before the Congress next year. How the Congress will fare in passing this must-pass legislation is uncertain. I mean, if you think about the budget process, I mean, Congress has not exactly been very fastidious about doing their duty when it comes to important things like the budget. I was just reading the Wall Street Journal today. They're trying to figure out, can we pay through things through December or through 2017? Still up in the air. We don't know. But we still have a responsibility to pass legislation, and particularly in regards to healthcare policy. So Katherine will be discussing how Congress may find common ground on certain healthcare legislation, including the Children's Health Insurance Program, expiring Medicare provisions, the looming Cadillac tax on high-cost healthcare plans, and the reauthorization of drug device user fees that fund the FDA approval process. So please join me in welcoming Katherine Hayes, the Director of Healthcare Policy at the Bipartisan Policy Center.
Thank you, Professor Corser, and I also thank you all for being here today. No pressure, this is the first policy lab. If it's a failure, it's all on us, but no, it'll be great. So I want to tell you, I have a 22-year-old son who I will tell you is on the 4th year of his gap year after his freshman year and is trying to decide what to do with his life. Number one, don't worry about it. It will all fall into place. You don't need to know what you want to do. But more importantly, I know that you all have classes that you have to get to, and that if you're anything like Matthew, have a really short attention span. So if you don't make it to the end of this lecture, number one, public policy is, and I'll sort of summarize everything. Public policy is really cool, and it's fun to work in Washington. You get to do things at a very young age that you would never otherwise be able to do. A friend of mine used to joke that every nerd you knew in high school is now in Washington and has power, and which was quite a frightening thing. And the second thing is that I'm sort of biased toward working on the Hill. I worked for members of the House, members of the Senate, Democrats and Republicans, and I sort of had career ADD, and I still do. So don't worry if you don't know what you want to do right now. Again, I can't emphasize that enough. But at the end of the day, no major changes are going to be made to our healthcare system, status quo, for those of you who have to leave. And go to Washington and work because it is so much fun. Even if you don't stay there, just the city's a great place to live, lots of nice restaurants, lots of young people, things to do, and the opportunities that you'll have, even if it's just for a semester, is well worth the investment of your time. So with that, thank you very much. So I have a few disclaimers first. Number one, the Bipartisan Policy Center is not a nonpartisan organization. BPC's leaders and staff are very partisan Democrats and Republicans. But what we do is come together to try to find compromise for the common good. So when you see a proposal that we put out, there may be things in there that seems really convoluted and doesn't make any sense, and that is the product of compromise. Just look at the Affordable Care Act. That's a good example. But also know that there are things in a package that often a Democrat will agree to or a Republican would agree to that they normally wouldn't otherwise support if it were standing as independent legislation. But as part of a larger package, they're often willing to make trade-offs. And I forgot my water, so hang on one second. I'm sorry. In thinking about all of this, I just wanted to stress to you that you're not going to hear nonpartisanship when you talk about the Bipartisan Policy Center, when its leaders talk about it. It's really, it's about compromise, and it's about finding common interests and working together to improve programs. Next, in talking about, and this is really important, any remarks that I make today do not reflect the opinions of the Bipartisan Policy Center or any of its leaders. Okay, that's out of the way. And also, in talking about opportunities at the federal level on health care, I think it is appropriate to sort of paraphrase former House Speaker Tip O'Neill in that all health care is local and state in many respects. So although I'm going to talk to you about federal health policy and some of the issues that we're facing, recognize that so many decisions about health care are made at the state and local level. And for those of you who don't want to make the trek to Washington, I would really encourage you to get involved in state government, particularly if you're involved in education or health care, because the state has so much impact on those issues. And then finally, I worked for a Republican Senator, John Chafee, for 7 years, and I wanted to mention him because the years that I worked for him have really shaped my views. It was sort of a coming of age 7 years in my life. And he was former governor of Rhode Island, former Secretary of the Navy, part of the first Marine Corps landing at Guadalcanal, part of the greatest generation that you hear about. And he had a sense of integrity that I have never seen before. And he taught me that it's really important to always tell the truth, even if it's not what people want to hear. You can couch it. I have a friend who's very good at telling you that he will speak to a group and tell them that they are absolutely right in their beliefs, and then he will go on to tell them why in this case that's not true. So I always appreciate that. I asked him where he learned that skill, and he very embarrassed, he was a little embarrassed, and he said, well, actually, I answered a suicide hotline when I was in college. And what you have to do is convince someone, you have to make them understand that what they're feeling and validate what they're feeling, but then change and then explain to them why that isn't the case right now. And as important as mental health is, I'm not trying to make light of it, but so much of politics and policy is understanding how to talk to someone in a language that they understand, and then explain to them or have a conversation with them and learn from them to understand why things might be a little different from what they expect. And how important compromise is another thing that I learned from Senator Chafee, and that's not very popular today. Compromise is a bad word. And so it's really important if you want to get things done, and I'll just move on from there. And then finally, I am a Democrat. Even though I worked for a Republican, I just want to tell you right now that everything that I'm telling you right now, I'm trying to be fair and balanced, but recognize that I am a Democrat. In 2008, I was a senior advisor to Hillary Clinton's campaign and a surrogate for her. So just so you know, I will try to relay the Democratic and Republican view on everything else, but I am a Democrat. So I want to address three basic issues today. One is how presidential and congressional elections will shape healthcare legislation in the future. Two is talking about what national issues that we can expect and changes we could see in health reform today. And then finally, what are the must-do issues for health reform and what we can expect to see happen. So in talking about the congressional election, I want to stress that there are three co-equal branches of government. Despite what you will hear from Donald Trump, it's not all about the presidency. You don't have unique power there. And many legislators really don't understand that. And so I want to lay that out. First, in the legislative branch, we probably won't see much change. The Senate could switch from Republican to Democratic control, but because of arcane rules in the Senate, you have to have 60 votes to stop a filibuster. And never underestimate the power of a U.S. Senator to shut down the U.S. Senate. It can be done and is often done. And now they've gotten kind of lazy. There was this great thing on Jon Stewart once in which they showed a filibuster, which if you ever see the movie, and when you get in front of an audience, things just escape you. But the Jimmy Stewart, Mr. Smith Goes to Washington. I knew I'd eventually get there. So you will see a filibuster in which he literally stays on the Senate floor night and day trying to hold up legislation. Well, now what they do is just sort of, someone will say, okay, I'm going to filibuster, and someone else will say, oh, well, I don't want to stay up all night, so why don't we just assume you're going to filibuster? We'll talk until 11 o'clock, and then we'll all go home and go to sleep. So recognize that you see very few actual filibusters on the Senate floor anymore. So although we may see the Senate switch hands, at the end of the day, there may not be a lot of change, a lot of significant change, unless we start to see the kind of compromise that is really necessary to make things happen. So second, executive branch, unless things change dramatically, if Trump wins under a Trump presidency, you'll probably see him putting forth a lot of proposals, a lot of legislation. You'll see a lot of action in the Republican-controlled Senate, in the House, but you won't see much. The Senate will block most of the major legislation. So no matter how many times you hear Republicans talk about repealing Obamacare, it's not going to happen as long as you have, even if you have a Republican president and a Republican-controlled House, unless there are 60 Republican votes in the Senate, there's not going to be repeal. So the challenges associated with repeal, just to say, there are a lot of very popular provisions in there. And one thing I want to take a step back, as much as everyone is sort of really demonized Obamacare, if you look at healthcare generally, 85% of the public have employer-sponsored health insurance. So they were not really affected by the Affordable Care Act. There were some changes, in terms of their insurance policies, but very generally, it didn't affect them. What we are talking about, there was a Medicaid expansion, which hasn't happened in many states, but what we're really talking about is the small group insurance market and the elimination of pre-existing conditions in healthcare and community rating in health insurance coverage, which means that instead of the youngest, healthiest person being charged $25 a month for premiums, and this is bad news for all of you, and the oldest person, sickest person, right before they're ready to go into Medicare, being charged $1,000 a month for their insurance premium, they now have to sort of average those premiums. First of all, they have to take everyone, and then they average the premiums so that the oldest, sickest person pays no more than the youngest, healthiest person. So all I can say to all of you students is it's really bad news for those of you who are trying to buy health insurance in the individual market. But rest assured that if all goes well, someday you will be old and sick and you will get lower health insurance premiums. It's the best I can say. So, and then finally, the one thing that I think is so central to these elections, the most important thing about this election, and it's underplayed sometimes, is the Supreme Court nomination upcoming. If Donald Trump is elected president, we'll pretty much have the status quo. Antonin Scalia was a conservative, probably one of the most conservative justices out there. So there are, I can't think of many people that he could appoint to the Supreme Court that would be more conservative than Antonin Scalia. So little change, pretty much the status quo in the Supreme Court. If, however, Hillary Clinton wins and has a nominee to the and is able to nominate a person to the Supreme Court, then you're going to see a change in the status quo. So I think even though it's not really talked about much, it has come up in some of the campaigns, but that is probably going to be one of the more significant things that come out of this election. It could change if Hillary wins the balance of the U.S. Senate, particularly when it comes to things like Roe versus Wade and some of the other issues that campaign finance reform, you could have a change there. There are a number of things that could be affected by that. So one thing that I really want to highlight, even though Donald Trump is talking about, and Republicans continue to talk about, repealing Obamacare, and there are a number of popular things in there that make it difficult to repeal, such as allowing students to stay on their parents' policy until they're 26 years old, elimination of pre-existing conditions. But another thing that he's really been talking about and is sort of flies in the face of traditional Republican views on health care. And one of the best examples that I've seen is his viewpoint on pharmaceutical costs. Traditionally, Republicans and many conservative Democrats believe in the free market, they believe in innovation, they're reluctant to impose heavy regulation in the pharmaceutical industry other than sort of the safety and efficacy side on the FDA. There's not a lot in terms of price regulation, but now presidential candidate Donald Trump is talking about regulating prices in the pharmaceutical industry, which is really making a lot of folks in Washington very nervous. The question is, will it pass? Unclear. It will be difficult, but there will be pressure coming on Republicans in particular to support proposals that are coming out of a Republican presidency. So that is one area that I think you could see sort of things shaken up a little bit. I will say, too, that inside the Beltway, when you talk to health policy wonks on the Republican side and ask them what they think about the Trump presidency, the first reaction is, I'm horrified. They're really worried. They don't know what to expect in healthcare. Trump has sort of run as the outsider and upsetting the status quo. And so for the health policy wonks in Washington, they don't quite know what to do with that. Some of the more conservative folks who would traditionally work on the Republican presidential campaign are staying away from the campaign. You even have some of the more conservative folks publicly saying that they would never work for Donald Trump. And so if he wins the presidency, we're beginning to see a shift. We're not too far out from the elections. We're beginning to see a shift in some of the Republican health staffers and some of the Republican advisors in that, oh dear, this could really happen, and I'm going to have to work with folks in a Trump administration. So the rhetoric is sort of dialing down a little bit, and I think a lot of them are really trying to figure out where health policy goes under a Trump administration because he has such a populist viewpoint on health care. So, and then with the Clinton presidency, I think that it's important to recognize under a Clinton presidency that, not a lot of her priorities. She's very well known for health care. She's very informed on health care issues, but that may not be her biggest priority. I think whether it's Trump or Clinton in the presidency, Washington is suffering from health fatigue. They're really tired about hearing about Obamacare. They're really tired about talking about health care costs and realizing that there are a lot of more pressing issues. So I think in the first 100 days, regardless of who wins a presidential election, you're not going to hear a lot about health care or serious debate about health care. Even in the campaigns, you're hearing about issues like trade. That's going to be a big issue regardless of who wins the presidency. There is a lot of concern that some of the trade agreements that are pending or that have been passed may not be in the best interest of United States healthcare workers or United States workers generally. So we might hear a lot about trade. We might hear a lot, and again, in a related area, jobs. You hear them talking about jobs a lot in the economy. I would expect that there will be a big push for tax reform in the next Congress. There could be some health issues embedded in tax reform if they come up with bipartisan legislation and are able to reach agreement. And I think of all the issues that will be addressed by the 115th Congress when they're inaugurated next year, tax reform should be one of those, and there should be a potential for bipartisanship there. Also, another issue is immigration. We're going to hear a lot about it. There are healthcare implications there. But the question is whether or not Congress is really willing to take this issue on. I would say that a few years ago, there would have been opportunities for immigration reform, maybe as many as 5 years ago. But with the populist rhetoric that's coming out of the presidential campaign, it's going to be very hard to see how we reach bipartisan agreement on immigration reform, although you will hear a lot about it. Another issue that we don't really hear a lot about is infrastructure, as we are not really maintaining our roads and bridges in this country. And that is very expensive, fixing those, but it's something that we're going to have to deal with. I don't know how many of you remember a bridge collapse in Minnesota a few years ago, but I would expect to see or hear more of that if we don't really do some investment in infrastructure coming up. And then finally, we should hear a lot about national security. Whether or not they will get anything done, I don't know. What are the things that must be done in healthcare next year? As Professor Corser mentioned, the Children's Health Insurance Program is expiring in September of this year. It is a very popular bipartisan program. So I would fully expect to see legislation move to reauthorize and provide additional funding for the Children's Health Insurance Program. There could be some changes, but basically the CHIP program, as it's known, is a block grant to states that can be used to buy health insurance, private health insurance coverage in some states. Other states have chosen to do it through the Medicaid program, the low-income health insurance program. And you will see, because many states are operating on a state fiscal year that begins July 1st, I would expect Congress to move in getting something out earlier in the year rather than later to give the states some security. It may not happen in Washington many times. You will see things delayed, but it makes it very hard for states to decide what their policy will be for children until they know how much they're going to be getting under this block grant. And the last thing they want to see is reports of states cutting health insurance for children. So I will expect you will see some movement on that early. Another issue, how many of you are familiar with federally qualified health centers? They are, not many people hear about them, know about them, but they are health clinics for low-income populations that are available to individuals regardless of whether or not they have health insurance. They are required to take every patient regardless of their ability to pay. They're required to offer a full range of health services, ranging from, in many areas, dental services, family planning, and just general health care. They do not ask about immigration status when you show up for care. So I would expect to see, and interestingly, federally qualified health centers are fully supported by both Democrats and Republicans. Republicans in particular, because they think they're in rural areas, which tend to be more conservative, and you tend to have more Republicans in rural areas. But the health centers also allow, and having, again, I don't want it to sound like I'm attacking Republicans, this is not negative, but having worked for a Republican, not all of them and believe that everyone has to have health insurance coverage. If you don't have health insurance coverage, there's an argument to be said that you can go and get health care coverage in places such as federally qualified health centers. As a result, many Republicans support funding for federally qualified health centers. So that funding expires next year. So I wouldn't be surprised to see authorization for FQHCs in the CHIP reauthorization. Medicare extenders, also mentioned, this is funding for rural hospitals to keep them going. In many areas, they're not breaking even with Medicare reimbursement rates and need additional subsidies from the federal government through enhanced payments, so there will be pressure to do that. So as you can see, there are a number of potential vehicles in the coming year, despite all the partisanship that we might see. And so we could see action in healthcare in those areas. And with that, I think I'd like to open it up to questions for those of you who would like to ask questions.
Unless I have just jumped the queue and taken over the Ath Fellows role, I've got a microphone, so please raise your hand and I'll come around.
Hello. I was just wondering, with kind of the newer move towards like a healthier lifestyle and approaching healthcare kind of in the secondary context with like Michelle Obama's Let's Move program and things like that, do you think there is, in the next 4 years or just in the future in general, there will be a move towards incorporating like healthier lifestyles or kind of other aspects of healthcare?
Mm-hmm. I think there is a very strong possibility. In fact, it's already starting to happen. One of the challenges in DC is that people with health policy backgrounds are really siloed. They're what I would call the public health people. Those are the ones who, support healthy lifestyles. I'm not one of those people, as you can see. I'm kind of grappling on this issue. But sidewalks, healthy communities, walkable communities, livable communities. And then there are those who think in terms of healthcare financing, health insurance payments, Medicare, Medicaid payments. And there's not really much of a bridge between the two. We have a public health program within the Bipartisan Policy Center. I'm on the financing side. And when the two of us sit down to talk, we often speak different languages. But I think you're beginning to see movements to bridge from both sides, a lot thanks in part to First Lady Michelle Obama. But in looking at health insurance, the current administration has, for the first time, reached out and expanded Medicare to cover a prevention program for diabetes management, the YMCA programs, which doesn't seem like much. But if you think of it from a healthcare financing perspective, You can't use Medicare or Medicaid dollars to fix streetlights or build parks because it's an entitlement program. But when you start talking about clinical health services and prevention services, we're beginning to see a little movement. Another example is that the Center for Medicare and Medicaid Innovation, which regulates the Medicare and Medicaid programs, has issued guidance, and you will see a lot of guidance. I should have mentioned this in my remarks, but even with Congress gridlocked, there is a lot that the executive branch can do through either agency guidance or executive order. And through agency guidance, the Obama administration has allowed states to look at housing support services for low-income populations in the Medicaid program, which is a huge step. They can't pay rent with it, but they can help negotiate contracts. They can provide funding with Medicaid funds to provide deposits for electricity and water, can do minor home modifications for patients with disabilities. And so we're beginning to see changes in some of these traditional programs that have really covered clinical services. They're beginning to branch out, and we're beginning to see more flexibility.
Hi, thank you for your talk. You briefly mentioned regulation of pharmaceuticals.
Mm-hmm.
Regardless of who becomes president, do you see any improvement in how pharmaceutical and different medicines are priced in America? For example, in Europe, there's a common argument that it's cheaper in Europe and even in many countries in Asia because of patent rights and because we're subsidizing them.
Mm-hmm.
Do you see any change coming to that soon?
I think the best that we can hope for realistically is perhaps bringing generics to market and biologics to market more quickly. I will say that there have been numerous attempts in the last 20 years to lower pharmaceutical prices, and they have been largely unsuccessful. Pharma has a significant influence in Congress among both parties. There was a proposal a few years ago and the Obama administration has put it out in its budget every year, to apply rebates to Medicare Part D and require pharmaceutical companies to pay rebates to the federal government, sort of a group discount, for want of a better term. And in a democratically held Congress with a Democratic president, that legislation didn't see the light of day. Congress has passed importation fees to allow importation of drugs from countries. There was sort of what some would call a poison pill rider to it, but I don't know that I would call it a poison pill because it does make a lot of sense. But it allows, the secretary has the authority to allow importation of drugs that have been approved in other countries, but she has to certify that they will be safe and effective. And because of the counterfeit market right now, there are a lot of counterfeit drugs that come into the country. None of the even Democratic administrations who have been strong supporters of reimportation have been willing to certify that those drugs would be safe and effective. And so I know that sounds a little cynical, but I just don't see any will in Congress to do that. I think that if Donald Trump is elected, you could see sort of a game changer a little bit because he's going to put Republicans in a difficult position, those who have traditionally supported the pharmaceutical industry. And so that could have an impact. But having seen this for 30 years, I'm not particularly optimistic that we'll see any change.
Hi, thank you for your talk. Do you think that the Trump campaign would have some success looking back at some of the healthcare proposals that the Romney campaign had, with specific regards to the universal exchange plan that they were working on? Do you think that that's worth looking at again and proposing? Thank you.
I think it would certainly be worth looking at again. I think one of the challenges is that now that the law has been implemented, it's going to be very difficult to change some of the more popular provisions. And if you put together, I think a national exchange would help solve a problem for those states that don't have, we're hearing about counties that don't have private health insurance offered. First of all, I would say that's in the individual market. There are still group market policies out there, but if you're trying to buy on the individual exchange, your choices may be limited. The challenge is that if you go with some national policy, health insurance is regulated at the state level. There are federal rules, but ultimately the states are the one that certify whether or not they're meeting those rules. And if you allow the purchase of a health insurance plan that is not licensed in your state, you have no recourse if they don't pay. So it's something that not many people talk about. It sounds great to say you can buy health insurance across state lines, but there was a problem back in I think it was in the 1980s with something called MEWAs. They're multiple welfare employer arrangements. And in Kentucky, for example, there was a MEWA that a number of small businesses in Indiana bought into. One was a large auto dealership in Indiana. And that MEWA went under. And like insurance policies that would be offered through a federal exchange, unless you required them to be licensed in the state, when it went under, people lost their health insurance coverage. They'd been paying in premiums for years, and many of them were being treated and were suddenly, they had been receiving treatment. The MEWA went under, and they were given bills by hospitals of hundreds of thousands of dollars. So if that approach does work, we're going to have to think really carefully about how you would provide recourse for individuals who either feel like their issues have not been addressed or not being covered.
Hello. So this is more international and less domestic, but I was curious, does the U.S. government or U.S. government agencies play a role in developing healthcare policy and infrastructure in developing nations? And if so, what is that role and kind of what does it entail?
Yeah, I'll have to say, first of all, this is sort of outside of my issue area. But I know that there are a lot of a lot of programs in particular funded through the State Department that have, and the World Bank, I think to the extent that the U.S. is involved in that, which they are. But I think it's mostly through the State Department. There are some programs that are through HHS, but I'm just not really that familiar with them. I'm sorry.
Thank you for your talk. I had a question about, you mentioned some policies that have bipartisan support, kind of like the FQHCs.
Mm-hmm.
Are there other things that are brewing or close to the cusp, or things that we'll see pushed, probably not later this year, but maybe into 2017? I know it varies depending on what administration, how the houses sit.
Yes, I think that once we get past, and you're beginning to see this among some Republicans, the chairman of the Senate it's the HELP Committee, Health, Employment, Labor, and Pensions, boy, I should know this. They changed the name, but it was like 2 decades ago, so I should know it. The former Labor Committee in the Senate. The chairman, Lamar Alexander of Tennessee, has publicly said, we need to stop talking about repealing Obamacare and start talking about how we fix it. And there's no questions that there are significant flaws in the law, and we're beginning to see it with insurance premiums being too high for some people. We're seeing high out-of-pocket costs. There are some issues related to employer arrangements that I think they are sort of, I'm trying to remember the correct term, and unfortunately I can't. But there are a few things that I think could be done if we could just get over the hurdle of saying repeal Obamacare. And I want to make it very clear that even though I say I am a Democrat, there are a lot of changes that need to be made in that law. And I think that before we're really going to see anything done, we're going to have Republicans agree that we're not going to repeal it, and we have to have Democrats agree that we're going to have to make some significant changes to make it work and make it more affordable and make it more sustainable financially for the federal and state governments as well. So you could see some, I would say, tinkering around the margins. There have been, and we have a link on our website, the bipartisan, it's bipartisanpolicy.org, although it may be, because it's in blog fashion, it may be really low. But if you Google a blog that I wrote, it's changes that have been enacted in the Affordable Care Act since 2010, and you will see a significant list of changes that really have not received much attention. But I think those sort of tinkering around the margin issues, you will see movement on.
Thank you for your talk. So we've seen in the news, like, there's been a lot of, I guess, buzz about viruses like Ebola, Zika, especially like with the Brazil, like the Rio Olympics are affected by that. But I was just wondering, in terms of health and human services, or like healthcare in general, in the United States, what is the status on like developing innovation against new threats, kind of thing? And if so, if it is good, then how does the United States play a role in stopping diseases around the world, kind of thing?
Yeah, again, I'm sorry to say that it's sort of outside my area of expertise. I do know that there are conversations right now going on the Hill, and they've failed to pass a Zika funding bill. There have been some amendments added to it that I think make it very difficult for others to support. I expect they will find compromise at the end of the day. There was significant funding provided for the development of vaccines on Ebola. And I think that what they're proposing right now is taking some of the unspent Ebola funding, and also there was a public health trust fund that was established under the Affordable Care Act to address concerns that we are not adequately funding public health programs in this country. That has sort of been considered a slush fund to fund other things, but there's still significant funding left in it. And there is also talk of taking part of the funding from Zika, from the Public Health Trust Fund to fund the Zika research.
Thank you again for your talk. I know that currently the states that have not expanded Medicaid are mostly in the South, and a lot of it perhaps is because how it's become, Obamacare and Medicaid expansion have become so politicized. Do you think that, though, it's inevitable that those states will eventually expand Medicaid, especially because they're losing out on a lot of federal money by not expanding?
Mm-hmm. I think that politics is playing a very large part in it. You see a lot of Republicans in states that would like to embrace ways to bring more federal funding for health care into their state. But the challenge is it's not all just political. If you look at the states that haven't expanded Medicaid, first of all, I think it's really important to acknowledge that unlike the federal governments, states have to balance their budget each year. They have to, two of the biggest pieces of their budget, if they are unable to raise taxes or unwilling to raise taxes, they're working with a finite amount of money. And increasingly, healthcare expenditures and education expenditures are taking up an increasing percentage of state budgets. And right now they're in a position, even if they would like to expand health insurance coverage in the Medicaid program, they realize that they're going to have to take that funding away from education or other priorities in the state. So it's not all about politics, it's also some very real issues. If you look at the states that are not expanding, in part, some of it is if you look at the Medicaid program, they are reimbursed on the basis, it's a federal matching fund. So in the Medicaid program, low-income program, health insurance program, states spend money and then they receive federal matching dollars for those programs. And the states that you see that are spending the most money or are more progressive tend to be those that have higher per capita incomes. And if the state has higher per capita incomes, then fewer people will actually qualify for Medicaid in the state, and it costs less. So when you're looking at some of the southern states, like Mississippi and Alabama and a lot of these states, a significant percentage of their population, or more than you would imagine, would be eligible for care under this program. The argument right now is that the new expansions are 100% funded, federally funded. so the states don't have to put up matching dollars. That amount is going to go down. They'll have to put up 10%, and it's, I think, time for us to go. But so anyway, it's a very complicated issue. And I think what you will see more in all likelihood is more and more states coming in to negotiate waivers with the states, with the federal government to expand coverage, so they can sort of say, I did it my way, and allow them to save face and do it in a way that they can afford.
Well, we can see that there are no easy answers, but with hard work and compromise, there are answers. So please join me in thanking Katherine for her speech today, and enjoy the rest of your time.